Hi, my name is Dr. David Swoboda. I'm the director of leukemia at TGH Cancer Institute. MDS Awareness Day brings light to a disease that I love and I take care of, which is myelodysplastic syndrome. I think the challenge with myelodysplastic syndrome, it's a disease that, most people do not know or understand until they get the diagnosis. And it's much more challenging as blood is a little less of a hard, an easy thing to really comprehend when we're talking about, what is going on in the blood, what does dysfunction of the blood, which is, the main characteristic of myelodysplastic syndrome actually look like and actually do to an individual. And so bringing that to light, this disease, and bringing awareness to the challenges that patients can face, whether it's low risk or high risk, is ultimately very important to me. I think, tangibly, when you think about, prostate cancer or breast cancer, it's a little bit, easier to show someone that and really convey what that actually looks like. When you think about, a blood cancer, it's harder for people to really comprehend, what their white blood cells are and their function, what their red blood cells are and their function, platelets are and their function, and how do these diseases and inability to mature, certain types of these cells. How does that actually affect a patient? It also is very different when we think about staging, because
Mm.
with, breast cancer, lung cancer, stage one, two, three, four is a little bit more tangible. It's either localized, spread to lymph nodes or advanced. With blood cancers, it's everywhere. And so staging, especially with myelodysplastic syndrome and acute myeloid leukemia, is more based on, what is the actual makeup of the disease, specifically what's the molecular makeup, chromosomal makeup as well, and how much leukemia cells does an individual have, as well as what their blood counts are. And so it's a little bit harder to, as a patient to really, understand that. But I think once you hear it, a few times and start, understanding, what are the different components of your blood in your bone marrow, I think it's a little bit easier to think about the disease and become more aware, and advocate for the disease. I think something that I really find rewarding and challenging with MDS is it's definitely a huge spectrum. So you have some patients that with myelodysplastic syndrome that have can be observed and might have a normal life expectancy, might never need therapy, and other patients where this could be a life-threatening condition in the matter of weeks to months. And that creates challenges because most patients get the diagnosis, and they think, worst case scenario. And a lot of times, in an ideal world, it's really not that. And it is really something that we can monitor or treat with, red blood cell stimulating agents or something that is very tolerable for our patients. I think, the other things that I find really rewarding is, with MDS, it does come with a lot of, decreased quality of life, just with blood transfusions and what that looks like and the challenges that are related to needing blood transfusions, with infections and being in and out of the hospital dealing with infections. So it really is a lot of complications that come with having myelodysplastic syndrome. And as a physician, if you're able to, use some of the latest therapies that we have to really improve that, let's say make someone transfusion independent for multiple years, or decrease, their infection risk, make them feel better, or in ideal world, get them to a transplant and even cure their disease. It's a very rewarding disease in that sense. And again, patients do not generally have a mass. They don't generally have a lot of pain, but that doesn't mean they don't have a lot of major concerns, decreased quality of life, significant fatigue, hospitalizations, all related to the disease that the physician has the opportunity to hopefully improve upon.